Well, it's a new year and it's time to talk about planning for your family as your loved ones age. And we have Carolyn Richardson with PACE Guide to Senior Living here with more. We're talking about care continuity and the continuum of care as our parents get older. Tell us a little bit about what exactly that means, Carolyn.
Well, a lot of times I hear families who talk about the fact that they have to repeat their history, their medical history, their loved one's medical history over and over again, depending on what specialist or doctor they're going to talk to or medical professional they're talking to.
Right.
This actually is a team of medical professionals that are able to follow the history of the patient at a great length of time. So they get to know, they're familiar with the patient's history, the patients are familiar with them, and they just follow them a long time, and it allows for that care planning to be a little easier.
Absolutely. There are other benefits as well.
Absolutely. So obviously you can imagine, like we talked about with the fragmented healthcare system, it does allow for treatment planning. It improves patient safety, quality of life, by allowing that communication to be easy and seamless between the different service providers.
Yeah, absolutely. Tell us about your PACE sponsor, Centrix Health Resources.
So Centrix Health Resources is a company such as that involves continuity, continuum of care. It is one company that envelopes home health, hospice, mobile doctors, non-medical home care, equipment, everything under one roof, so that the ease of communication can allow for that continuity to occur, and allows it to, you know, a family doesn't have to communicate their same story over and over again. That communication occurs under one roof.
That is amazing. You know, it's the perfect idea for the perfect time,
Right.
I think, with all the great changes and advances in medicine and home care. What prompted the idea of doing this?
So I think the owner of Centrix, he has been around in the healthcare community for over 10 years and really saw the fragmented and gaps in the systems. And as he's gone along, he's added different services under one roof to make sure that once a patient becomes a client of Centrix, they can always be moved along that continuum of care for whatever they need. And we've had, or they've had people who've come in, maybe needed one service, got better, and later on in life needed something again. They always view once a patient or a client of Centrix, always. It's very patient-centered. So we've seen people come in and out of the service providers, that continuity of care, and it has allowed for quality of life and quality of care.
Absolutely. You have PACE coordinators. How do they help?
Absolutely. So anybody can call in, speak to a PACE coordinator. We can kind of assess what their need is and get them set up with whatever they need. They can check us out on the internet. We can go meet with them face to face and do a full assessment to see what they need and link them up with all the resources they need to be successful.
Be curious to know what they say, what your customers say.
Well, they love it. They say, I wish we would have known about you sooner. Yeah. My loved one needed something a long time ago, and I wish we would have known. So they find it a great resource.
Thank you for being there. As I mentioned, it's a great time of our life to have an opportunity like this, home care. Thank you.
Absolutely.
And for more information, everyone, visit seniorhousing.org or call the number right there on your screen.